Hey everyone, in this video I want to talk to you about the differences among the types of pages that we're going to build on your website and what each of them are, so when we do the design phase you understand what we're talking about. So this is a website that we built for a client of ours. This is obviously the home page, but let's take a look first, because when we do your mock-ups, the first thing we're going to do are internal pages. An internal page is something like your service page. So let's take a look at ceramic crowns. So in this example we have up here, here's the header. And the header is standard on every single website. The header is a logo. Sometimes we have the address up here where you could see. We always like to have the phone number. Sometimes we have, we'll call this a top bar, where we have an appointment request with social icons. Sometimes the social icons can go over here. It really depends on what we're trying to do, what type of practice that you have, what kind of site we're building. You know, sometimes we'll make this into a button. Sometimes this might be pay your bill. So there's all sorts of options we can do in your header, and just so that's what that is. In terms of, this is now the main navigation. The main navigation is always going to be home, about, with some variation, services that you offer, reviews, patient information, or sometimes financial, or new patients, again, depending on what the focus is of the practice, and contact. So now that that's done, let's just take a look quickly at the footer. Footer is down here. The footer, again, this is standard stuff, in that when people use the web and websites, they expect to see certain things in the same exact places. If you were an artist and we're doing your art website, all bets are off. But for a professional services website like this, we need to make sure that things are where people expect them to be to improve the usability. So down here is our footer. So again, over here, usually sometimes we'll put an address down here, but we put it here in this case. Oftentimes we'll put a map, office hours, quick links if they're necessary. Sometimes you might have, fill out the paperwork here. Either way, this is a pretty standard approach, but this is the footer. And down here in the sub-footer, we can call it, or the bottom line, privacy, HIPAA, accessibility, and terms. Just have that for legal purposes. Over here, this is what we call, these are banners, or badges, depending on who you want to talk to. So sometimes we have badges, sometimes we don't. Sometimes we have badges on every page, sometimes we don't. So the footer could be, this entire area could be the footer, or this could be the footer. Oftentimes we'll have badges on the home page and not on any other page, but footer goes on every page, and header and navigation on every page as well. It's very important that the navigation is consistent across the entire site. You don't want to have a site where you change pages and then all of a sudden we change pages and then all of a sudden the navigation is different. That makes people crazy and it's very hard to follow. So let's take a look at an inner mock-up that on a service page. Let's look at Sealants. So in this case, what we did is, of course, we have a patient not wearing protective glasses while the image is doing a sealant. Okay, so either way, what we have here is this is called a hero area, or the banner area, or the featured image. So generally, when you have a website, the area up here at the top, let me zoom out a little bit so you can. Here, let me do it like this. So you can see here, here's the main content of the page. And you recognize you've got this footer, and you've got the header hasn't changed. So in this case, we have a picture. And again, this is called the featured image. Now over here, here's the text. Now in this case, we have a contact form built in. And that's something that we happen to have on the service pages here. Let's look at sedation. Same approach. See, we have a featured image. We've got the title of the page. Dallas helps for SEO, helps for orienting patients. Again, this text is different. Here we have a form, footer, exactly the same. Let's do one more of those just to show you. Let's do emergency dental care. Emergency dental care, same concept, right? Featured image, text, form, footer. Okay, so when we present you with your inner mock-up, we're going to show you something like this. Here's your inner mock-up. Okay. Now, what you might find, though, is sometimes on pages we don't do a featured image on every service page. It's kind of it's a design decision. So let me show you a website that does not have a featured image on the page. Here's a website for one of our pediatric dental clients, and you can see here it says extractions. That's the title of the page, with an image, read our reviews, but check it out, header is exactly the same footer. And let's take a look at another page here. Let's look at nitrous oxide. There we go. So this website is designed in a way that doesn't have a featured image on the page. And let's just take a look over here at more services. Let's look at tooth whitening for pedo. So we can see that the images are in the same place. Obviously, if we need more images, we put them there. But let's take a look at oral evaluation of reflux. You can see here, consistent, header, footer, the same. Text is what's different, image is different, obviously, but we don't have a featured image. And again, there's nothing correct or incorrect, right or wrong about either approach, but that is just what we do in terms of understanding header, footer, and then internal content. And again, this is not there is no featured image here, which is fine. Let's go back to the other site. So now that we've talked about that, the next mock-up that we're going to send you is the homepage. So the homepage keeps the same thing. The homepage keeps the header and it keeps the footer, but with a bunch of other customizations that we don't need to have on the other pages. So first let's talk about, again, notice how the navigation, exactly the same. That never changes. So now over here, this is called the hero area. Now, how is the hero area different than the featured image? And it isn't. So when we have a web page per se, right, a service page like sedation or veneers or even something like whatever, it doesn't matter, right? When we have that page, implant dentures, we are calling the area at the top of the page below the navigation or below the header, but above the text, we're calling it the featured image or the featured image area. Whereas over here, we're calling it the hero area, even though it's the exact same thing. But just in the web development industry, when someone says, what's your hero image, we're usually meaning a homepage. When we say featured image, we usually mean an internal page. So on the homepage, what we're usually going to have is a call to action, kind of like your tagline, call to action. I like to have contact us and learn more. And the reason is because two people are coming to this website. The first group of people visitors are existing patients who, I forgot your address. And I just, I'm one of those people who doesn't jump to the contact page or doesn't use a maps program. I want to go to your website. So I go to the website and I click contact us because, this is what I want. Here's the information. Or I'm a new patient, whether I got referred or I'm coming from the insurance company. Oh, learn more. Let me see. Oh, look at that. So that's what you want to have two. This is the hero area. This is your tagline, so to speak, or your title. Doesn't really matter. Tagline, although title means something specific in coding, but this is your main message. We call this whole thing like your call to action. It might say, we welcome new patients in our Dallas, Texas office. Contact us, learn more. So that is what happens in that area. Another example, let me show you. Here's a client of ours who's an oral surgeon, and we know immediately existing people come in, they have the contact page, but if someone wants extractions, because that's a large percentage of what they do, they wind up on the website and want extractions, boom, we're on the emergency extractions page. And again, that's because what do we think that people want to use this website for? And that's why we need to have a call to action. Let's come back over here. So here we have the home page, and it really depends upon, again, what you want to present on the homepage. Oftentimes we'll have a little welcome. We will have why choose us. Then I like to have approximately three service highlights. Because as you know from clinical practice, if you give somebody more than three options, it becomes very difficult for them. In general, all people. So the studies show that 3 is a good number. Excuse me. So we pick 3. So here's Invisalign, whitening, and here's just a kind of a new patient. Let's do new patients. So you can choose whatever you want. Oftentimes we tell people, pick 2 services that you're doing a lot of, that you want to do more of, and something that you want to try more of. Like let's say you just got a CEREC machine and you want to do more CEREC. Highlight that. These can always be changed later on, but at least this way, I want to promote the services that you think people want and that you want to do. We built this in here. Just, we'll have some variation. In this case, we have meet the doctors. We don't always have that. This client really wanted to have that. And notice we have that form again, and this is the same. So let's take a look at a different homepage. So this is also very, very simple homepage. So we have a nice little banner. Their call to action is read our reviews. That's what it is. But they have special needs, trauma, and nitrous oxide. Those are the things this practice has determined are important for their patients. So that is their hero area. That's their homepage. And then on oral surgery, extractions, contact us. welcome, your care is a priority, why work with us, what services. Then they have 3, meet the doctor, a form, and a map. So again, you can see the homepage has some variation. But it's standard in the sense that it's like a crown prep. There's variations on crown preps, but at the end of the day, they're pretty much all the same. I mean, other than your reduction, maybe, or your finish line, but your concepts are the same. So that covers these internal pages, and then that covers the homepage. Now, at this point, we'll have agreed upon our header, our footer, and so the next thing that we have to do is work out some of the other ancillary pages, such as meet the doctor. How do we want to have meet the doctor? Sometimes we put the affiliations into the text. It really just depends upon what the feel for your practice. A Newburyport here is Dr. Zekowitz. So here they happen to have a page about that they're board certified and AAPD fellows. So that's important. That's what their choice is. Over here, you see about is the same. Meet Dr. Ravinsky. So this is the same. And then over here, so we have some about pages. Sometimes here we have a meet the team page. And again, this depends on your staff and how your staff wants to do it. We like to just have the first name. So we don't want to, deal with anyone's privacy, infringe upon that. So we have that. And then our office. I like to have office tour coming soon. Okay, we didn't build the office tour yet. So in this case, let's take a look at this one. Office tour. And you can see this is all consistent. So here's a really great office tour. You don't necessarily have to have it being very formal, but here is, their office tour, which is great. Very welcoming. And then, then over here, let's get rid of these. These are in our way. Then over here, we have reviews. This is our review widget. You could use any review widget that you want. A lot of times, when you're paying for a review service, what you're really paying for is the integration with your practice management software. So, if you're in Dentrix and then you finish the patient appointment, you click, send review, it integrates with the PMS. And that's great, but that's really what you're paying for. Sometimes those widgets are ugly. We have a beautiful widget that we use that's a nominal fee every month if you want to use it. And it pulls in Google reviews, it can pull in Facebook reviews, but this is this. And so, because we do not provide a service where we integrate with your practice management software, that is a completely separate, service, separate area of expertise that we just don't do. So we like to have you do that with your service provider, because with that, they integrate the texting, appointment making sometimes. But if your review widget is ugly and you don't like it, we can offer you this one for nominal fee that builds in. Let's see, it just really looks nice. You can see here. There we go. It's beautiful. Okay. Either way. So moving along, that's reviews. So we're going to give you an about page mockup, a patient information mockup. Now notice on this page, you can see here, this hero area, or this banner area, we could also call it, does not have an image, which is fine. So let's take a look at about. Our about page has text. Our Meet Dr. C has text. Our Meet the Team has text. So in this case, what we've chosen is that our service pages will have these featured images, but our kind of additional pages will not, which is great. I mean, it's fine. New patient forms, insurance. So, but this is also an example of an inner page. This is also new patient forms, an inner page. So the difference here for our inner pages, you can see, form, badges, and footer. You can see that what we've done here is we said, okay, we've got our inner pages of inner pages. So service pages are all going to have the featured image and the form, the badges, and the footer. Whereas our other pages are going to have text, form, badges, footer. Over here, it's a patient info, same thing. New patient, so exactly the same thing, which leaves us then with the reviews page, which we talked about. Homepage, obviously the Meet the Team page, certainly the layout's going to be slightly different than you can see here that your Meet the Doctor page here and Meet the Doctor page here will have slight variations depending on the content. But you can see, again, the header is the same, the footer is the same, with a little bit of slight tweaks of the internal layout to match the content. But new patient forms, exactly the same, new patients. So you can see what we'll do is for these kinds of pages, it doesn't have to be fancy. But for a doctor page, we might spice that up a little bit. But here's a very basic Meet the Doctor page, which is perfectly adequate. It's great. Now, contact. So what we're going to have is the contact page, depending, sometimes we have a featured image. Sometimes we don't. We like to have address, hours, phone number. If you have an online appointment service, we'll put it there. Sometimes a map and directions. Sometimes we'll put a map down here. Some practices really want a map on every page. Some don't. Here's a built-in form on that page. You could do that. And here's an appointment form. This practice likes to take forms online like this, which we could do as well. They're not using a service, and that is one approach. Let me just show you one other site. So this site, this is a prosthodontist, and you can see very similar. Always welcoming new patients. We skip the social icons because it's not really what his population does. But here, it's older patients. So here is, and we're not saying that older patients don't use social. It's just a judgment call. So there's, the logo. He has the address, phone number, and contact. Homepage. Welcome. What's a prosthodontist? That's important. How can we help you? That doesn't mean he doesn't do other things, but here are 3 main things. He added other services to the homepage. That's fine. Meet the Doctor. We got some reviews built in there. Contact, banners, and there's a map. So let's take a look at his service pages. So for him, we kind of used a combination in this hero area, or the featured image area, of services. So we know where we are. Dental bridges with a little picture. And here we go. Always welcome new patients. Badges, footer. Let's take a look at implant dentures. Perfect. Implant dent. You see, so it's exactly the same internally. And it's simple. This is for, again, generally older patients. And this is nice because it's just very simple and basic, for this layout. Whereas university over here is a little more complicated, but he's looking for a younger demographic. This is a prosthodontist demographic. So patient info, they're going to add that. That happens. Here's financials. You can see it's exactly the same. And in this case, we really didn't veer too far off on the designs. So you can see that, hey, in this case, look, these internal pages look the same as the service pages. And yeah, they do, because that's how we chose the design. But understand that doesn't mean one is right or one is wrong. In this case, we also have a custom smile gallery, which is really important for pros. So this we built out custom for him, but this is additionally something that's really important, let's say, for some practices. Newer practices don't have a gallery yet. Contact. Here's the contact. You can see very similar. And contact, let's see, referrals. He gets referrals. So they have a referral form and a referral card, which is important for them. And then the home page, you can see, same idea. So that's pretty much your design process when we look at your internal page mockups, your home page mockups, and then the accessory pages like the about, contact, and a blog page. We're not always often doing a blog these days. I mean, you will do a blog, the blog design, but a lot of our clients are not putting up a blog yet, or they are, but the problem is that we're not necessarily doing a lot of reading on blogs these days. So let me see if we have it even on this one. All right, let's find another site that has a blog. Let's take a look at this. Okay, so here's, again, similar concept, but we did hear that you'll find interesting is that it's very important to doctor here to have cosmetic dentistry and same-day dentistry in the main navigation. So we did. Nothing wrong with that. Notice the navigation's a little smaller, but who cares? I mean, it's a purpose. Here, his call to action, request an appointment, get to know us. Same idea. Highlighting insurance, payment plans, emergency care. Then I wanted to show you the blog. About, should be under About blog. There we go. So now, the main blog page is really kind of a standard that we have. It doesn't necessarily mean people are coming here a lot, but usually we have an image of the blog post, the title, and a description of what's going on there with the first few sentences. This is called the blog archive page. Not a very traffic page on most websites. And the blog page itself, what we'll do is, again, depending here, sometimes we'll have the date. We like to have the title. Sometimes we'll have a hero image on it, a featured image. Sometimes we won't. But what you'll see here on a blog page is that on the right column here, this right side area, we're usually putting something in like recent posts, categories, and a call to action. So that's really the difference with a blog page. Let me show you a different blog. Let's find, how about, let's do, let me just pause and pull it up. Okay, here's this website. Do we have a blog on this one? Patient information services, office tour. We got, here they happen to have post-op instructions. But again, same concept. Let's take a look at, I don't know if Compass has a blog. Nope. Again, and you can see, so it's not really, we have the pages designed, but it's not a focus of a lot of people. Let me find another one. Okay, here's another site. Again, same thing. Look, we put all on 4 here in the middle. Here's a thinner header. They wanted emergency care on the top with their app, and here is the logo, phone number, book appointment, done. Here we added all on 4 in there because that's what's important to them. Get to know us, book appointment. Same concept. Now for their blog, let's see. So here's again that same kind of list. Why does my denture fall out when I smile? We do have a hero image there we don't necessarily need, but here we go. Recent post categories, call to action. And these guys really wanted to share this post, so we have that. And that's a story. So hopefully that will give you a really good idea of what we are looking for, what you should be looking for when we have on your internal page, your home page, and the other accessory pages. As always, let us know if you have any questions, and we look forward to seeing you in our design phase and the amazing designs that we will do and for your new beautiful website. Thank you.